To discuss the plan, chaired by this man, Dominic Raab, the Foreign Secretary, who is deputising for Boris Johnson. Opposition parties back an extension to the current restrictions, but are asking questions.
We would expect the lockdown to continue. We would support that. I actually called for a lockdown before the government introduced one, but we also want more details from the government about what happens next. The best way to come out of lockdown, or to manage a way out of lockdown in the coming months, is to move to a testing and contact tracing strategy. So I'll be looking for the government to give us more details today on where they are on the promised 100,000 tests a day. We're only at around 16,000 tests at the moment.
The government is desperate to keep the message we've got used to about the lockdown simple and not start talking publicly about the long term. Lots of things are being talked about privately. Could there be, at some point in the future, a removal of some of the restrictions on younger people, or an expansion in the list for key workers? A lot will depend on how things are looking. How many people are being sent to hospital with the virus, and how does that compare with the number of beds?
If we relax measures too much, then we'll see a resurgence of transmission. What we really need is the ability to put something in their place. If we want to reopen schools, let people get back to work, then we need to keep transmission down in another manner. We will have to maintain some level of social distancing, significant level of social distancing, probably indefinitely until we have a vaccine available.
So while we've had to get used to pictures like this, there is another blunt truth of how long it'll be before anything like normality returns, for some of us at least.
The lockdown has been incredibly effective. There's a magic number called the R0, which is the infectivity of the virus. One person will infect 2.6 people at the beginning of lockdown, and now it's gone to under 1, to about 0.6, 0.7, which is great news. Lockdown is working. The problem we have is how we get out of lockdown. And do we do it slowly? Do we do it fast? But we're going to learn from the European countries coming out this week.
This is going to be a long haul and a spring and summer like no other. A huge challenge for all of us and very difficult decisions for those in charge. Chris Mason, BBC News.
When some of these measures might be relaxed, ministers very reluctant to talk about that in public. They just keep saying that it's clarity of message, staying at home to protect the NHS and saving lives. They really feel that's got through, and they don't want that to be diminished at the time when we are reaching the peak of this epidemic, and sadly more than 700 people a day still dying. Now, our health minister has talked about this as well, tweeting about unless there's a vaccine, it's going to be hard to completely lift the lockdown. We are going to have to change the way that we live, maybe for some time. They're trying to strike that balance between the nation's health and, of course, the economy. Now, the Prime Minister's official spokesman has been doing a daily briefing with journalists, and that message has come across as well. Just too soon to talk about this. You know, asked about questions of schools, for example, could they reopen, maybe in some parts of the country, not others, just saying that that is too soon. The same response when asked, could certain
open facilities within their borders. The president can provide guidance, he can provide suggestions, and of course, being the president, that carries a certain amount of persuasive weight, but it is the governors of the United States who actually hold the power.
I thought I heard from America.
Some workers are as keen to see a return to normal as the president himself. Conservatives in Michigan organised this protest against a stay-at-home order imposed by the state's Democratic governor, defying social distancing guidelines to make their point. Millions of Americans have lost their jobs in recent weeks, and the coronavirus has brought an economy that President Trump
expect us to be holding the government to account. The reason that we have to do that on a virtual basis is we're telling the public not to travel. We're telling the public to work from home. Quite simply, it would not be a good look for parliamentarians to be travelling long distances to London when we don't need to.
Tory MP Stephen Crabb, who lives in Pembrokeshire in Wales, has been chairing committee meetings from home.
Inevitably, there's a few teething challenges. chairing a meeting of a committee where you have 10 other people in the room all wanting to perhaps talk at the same time. It's much easier to chair that when you're physically in the same space.
These changes are, of course, a response to the current crisis, but in truth, nobody really knows when things will get completely back to normal here. There is still some debate on exactly how a virtual parliament functions, but for now, MPs will have a bit more time for views like this. Nick Early, BBC News, Westminster.
As well as deaths, but early data show that one demographic group is being hit harder than others, African Americans. Numbers from Louisiana are the most staggering, with blacks making up more than 70% of deaths, despite representing just about a third of the population. The explanation lies in decades of racial inequalities, leaving African Americans more exposed, more at risk, and less informed to face the virus, as we found in Baltimore. A coronavirus testing site in the middle of a race course. The city of Baltimore recently opened this testing location after data showed that this area of northwest Baltimore, where 95% of the population is black, had the highest number of COVID-19 patients in the city.
It was inevitable. It was going to come anyway to us. We get everything. It's getting harder. People getting prepared because people are going to be really broke, really stressed out, and when you're in them kind of neighborhoods, people start preying on the weak. The best that we can do is just keep the house clean and stay away from people, try to keep people away from us.
I have COPD, and I know it can infect me quicker, so I just stay in the house and do what I have to do in the house and get my son to do everything for me. Are you afraid? Yes, I'm very much afraid.
Data published by the Center for Disease Control shows African Americans are disproportionately affected by the coronavirus. Here in Maryland, black residents make up less than a third of the population, but represent 37% of COVID-19 cases and 44% of deaths. For Dr. Slocum, the coronavirus is simply emphasizing pre-existing inequalities.
What COVID-19 does is it illustrates and exemplifies the disparities which already exist in our healthcare system already. So, as you can imagine, access to healthcare, pre-existing conditions are some of the things that are most prevalent in communities of color. So when something like this hits, of course, it's going to hit communities of colors more rapidly, harder.
Underlying conditions like diabetes, obesity, or lung disease are more prevalent among African Americans, making them more vulnerable to the virus. But blacks are also overrepresented among frontline workers like bus drivers, nurses, or food workers. More exposed and more at risk, African Americans are also less likely to have the resources to face a pandemic.
Poor people are more vulnerable, and it's not because of biological structure or anything like that. It's because of all the underlying factors that don't get addressed because they're poor and don't have access to the resources, medical resources, etc., to respond to it. Health information, resource information, healthy eating, access to information is a major issue.
Keeping the community informed has fallen back on local figures who use any opportunity to remind people how to stay safe and take the virus seriously.
6 feet apart. I'm going to tell you something. If you don't have a mask on, you need to start wearing a mask. This thing is no joke out here. You got a lot of people dying, a lot of people getting sick, and you heard the news lately. They're sad, especially with black men.
Baltimore community leaders are also worried about the economic impact of the outbreak in neighborhoods that are already struggling financially, a fear that is common to communities across the country. Just like in D.C.'s Georgetown neighborhood,